Welcome to today's session, sponsored and put on by the East Texas Geriatric Education Center, addressing difficult topics in aging and disease. This is session 3 that will focus on everything you need to know about cancer. I would like to acknowledge our partnership with the East Texas Area Health Education Center East that have been really valuable in terms of our collaboration and distribution and connections with our consortium partners in East Texas. Okay. This is, as I said, the third session. It's in a series of 4 dealing with these difficult topics. And when you want to look at it, it is really about challenges to working with older patients and disease processes. And we will have our final session on the 3rd Wednesday in May 16th, looking at modeling long-term care that will focus on nursing home residents and older prisoners. And we hope you can make it then as well. This will be a very short introduction because we have a lot to do today and a lot to fit in 3 hours. And everything is in your handouts, so I'll just briefly go over this so we can get going here. You have your agenda here with our 5 speakers, and this will cover the whole gamut of cancer care with an overview of basically epidemiology of cancer given by Catherine Coaxley, then looking at screening with Dr. James Goodwin, treatment of cancer with Dr. Holly Holmes, a short break, and then to kind of go along with treatment, what about over-treatment or aggressive treatment? And this will be given by Dr. Gulshan Sharma. And finally, with Dr. Linda Elting, supportive care, not just for treatment for end-of-life care, but this new wonderful area of survival of cancer. Okay. And this will also be set up now as a webinar, and I will give you later on, those that are connecting as a webinar, the number to call in for questions and answers. Okay. The whole day has a list of learning objectives, which are listed here and in your handout. And we teleconference to our 5 of our consortium partners in Lamar, University in Beaumont, Stephen F. Austin in Nacogdoches, Baylor University in Waco, Victoria College in Victoria, and Weatherford College in Decatur. Okay, there's lots of information available for CME. These are all free credits for doctors, nurse practitioners, and physician assistants. I need to disclose that all except Dr. Linda Elting have no commercial financial interests or affiliations to disclose. Dr. Elting discloses the following relevant financial relationship with Helsinn Pharmaceuticals in terms of having grant and research support. And the same for nursing with CNE, similar disclosures, and all the paperwork evaluation forms are in the back. Physical therapists, we have CEUs available as well as for occupational therapists. Okay. This is really about CERCIT, Comparative Effectiveness Research in Cancer in Texas, and all the speakers are affiliated with CERCIT. And you can find out more about this work being done, this collaborative work, which has been wonderful because we've been bringing in other researchers from MD Anderson, Rice University, University of Texas School of Public Health, and Baylor College of Medicine, and the Texas Cancer Registry.
Well, good afternoon, everybody. Continue, please. Keep munching. Enjoy your lunch. So I'll be starting off this CERCIT extravaganza of cancer-related information with a brief review of the big picture of cancer epidemiology. I realize it's a little risky and a little contradictory using the 3 words epidemiology, big, and brief in the same title, but I'm fairly confident that I'll be able to set the stage for the rest of the experts this afternoon who will discuss different phases of care in an aging population as it relates to cancer. So I didn't want you to feel cheated by not including a couple of definitions since the word epidemiology was in the title. So before we move on, as I go through the next several slides, I'll be referring to cancer burden. And there's a couple of basic concepts that go into figuring out the cancer burden in a population. So before I launch into the statistics, I'd like to just go over a couple of things which indicate that a cancer burden may or may not be changing in a certain population. So the cancer burden is determined by the incidence, which includes the newly diagnosed cases, survival, how long a person lives after they've been diagnosed with cancer, prevalence, which is the cumulative total of all cancer cases still alive. People refer to that as a snapshot of the moment, however many people are alive at any given time with cancer. And it also depends on the number of persons in the population who may be at greatest risk for developing cancer. So who are those people who are at risk for developing cancer? Several factors go into play, including aging, family history, exposure to carcinogens in several different ways, either through behaviors such as the use of tobacco, through the environment, through contaminated air and water. And occupational exposure is another risk factor in some occupations. And an example of another would be a combination of any of those things or the existence of other conditions. And we're going to touch on that a little bit later as well. Okay, so now the big picture. We're starting global. So taking into account all those factors that I just mentioned, the worldwide burden of cancer looks something like this. The dark red indicates the countries that have the highest prevalence of cancer, which means that within the 5 years since they were diagnosed, those folks are still alive with cancer in the heaviest concentrations in Australia, Europe, and North America. These data were compiled by the World Health Organization through the use of a project that they have called GloboCan. And this takes data compiled through the year 2008 to come up with these estimates. So the estimates that they've come up with for the year 2012 is 12.7 million new cancer cases that will be diagnosed worldwide, 7.6 million deaths, and an overall 5-year prevalence of 28.8 million people alive in the world with cancer. Okay, so moving a little closer to home now in the U.S. estimates that I'm presenting here were compiled from the SEER Epidemiology and Results program that's sponsored by the National Cancer Institute. And these projections are published in the Cancer Facts and Figures publication that's put out by the American Cancer Society. And the estimates for 2012 are that there will be 1.6 million new cancer cases diagnosed, with California having the majority of, or the most cases, followed by Florida and Texas. And it's not horribly surprising that that these states have the highest incidence or greatest number of cases diagnosed, because they're also the most among the most populated states. But what might be a newsflash to you is that these cancer statistics were compiled using data through 2008. And just on Monday, the new cancer statistics report using data compiled through 2009 was just posted on the SEER website, allowing all of the statistics to be now calculated using more current data. So the prevalence that's estimated for the number of cancer cases alive now in the United States is right around 12 million. And it's estimated that about 60% of those folks are over the age of 65. Okay, now even closer to home, new cancer cases for 2009, a little bit different cancer data source was used to compile these statistics, and these were just released recently in January by the Texas Cancer Registry. And their figures are estimating in Texas, out of the 24.8 million folks living here, 97,605 new cases will be diagnosed in the year 2009, or were diagnosed in 2009, with Harris County, again, being the most populated county, having over 14,000 out of their 4 million population, and Hartley County, which is somewhere over around the west part of the state, has the lowest number of cases, with 16 out of their population of about 5,000. So the Texas Cancer Registry estimates that for the year 2011, based on all of that data, there will have been 110,000 cases diagnosed and 38,000 plus deaths. And the prevalence, or as of January 1st of 2008, there were roughly 450,000 folks alive in the state of Texas with a cancer diagnosis. Okay, so getting even closer to home, using those statistics that were just compiled and released by the Texas Cancer Registry in January, one can, they've processed all of those rates into county incidence rates. And they also have the population data estimates for 2010 based on the 2000 population data. And those, the reason I mention this is that for the counties included in the AHEC regions that you all serve, all of those data and those numbers can be extracted from the data that the Texas Cancer Registry compiled. Okay, so bringing all that into perspective with caring for an aging population, I wanted to just show this briefly to indicate that as one ages, you could see that the risk of developing cancer increases as well. And even closer to home in Texas, applying the risk information with the incidence information and the prevalence information I just gave you, I just wanted to present to you the changing structure of the population pyramids, or the population structure from 2000 through the year 2020 as estimated by the US Census Bureau. So just to summarize the numbers for you, in 2000, there were about 2 million residents of Texas aged 65 and older, which made it about 10% of the total. And in 2010, based on the estimated population, there would be 2.6 million, which would have represented 10.5% of the population. Now, these totals are projected to increase to almost 4 million by the year 2020, which would mean that about 13% of our population would be over the age of 65. To summarize a little bit about what we know currently about the state of cancer in the United States, as cancer care continues to improve, along with all phases of cancer care, including screening, treatment, and so forth, the likelihood that a cancer patient will die of their cancer has been decreasing. Based on the United States estimates by the American Cancer Society, well, actually based on the SEER data and published by the American Cancer Society, the reportedly over about 1 million lives or cancer deaths had been avoided in the last 17 years due to the advancements made in care. So to summarize, we know that cancer incidence is continuing to increase, although the rate at which it's increasing may be slowing down in some areas and with some cancers and increasing with other cancers. New therapies and detection methods continue to be discovered, and cancer patients are now living a lot longer. From 1977, when only about 50% of them lived 5 years beyond the diagnosis of their disease, to 2007, where over 67% now survive 5 years after they've been diagnosed with the disease. We also know, as I just showed you, that the population's aging, and the lifespan has nearly doubled in the last century. So who's in this aging population? Well, depending on who you ask, the definition of old is going to be different. And even if you go back and ask those same people their definition of old after they've celebrated their next birthday, their answer may have changed. So all of that considered, the aging population's very heterogeneous. Different things go into how long a person's going to live, depending on all sorts of things. And different people age at different rates. One thing that's extremely important, we mentioned earlier on, is the coexisting conditions that older people are more prone to. There's an estimated 80% of those over the age of 65 have at least one coexisting condition, and approximately 30% have 3 or 4 coexisting conditions. Now, this list is just a beginning, just a brief summary of some of those conditions that are likely present in patients with cancer. And it can work both ways. An aging population could have these conditions already, and that may predispose them to developing cancer in the future. So they may not be presenting with it currently. Cancer care in an aging population can be very challenging, but it can be tailored to each individual. And if one considers the characteristics of each patient and considers the best interest of each patient. So our experts are going to be talking to you about questions and things to take into consideration and in the interest of the patient regarding cancer screening, which will be discussed by Dr. Jim Goodwin. Dr. Holly Holmes will discuss the cancer treatment and all of the different decisions, including consideration of all those coexisting conditions. Dr. Sharma will discuss end-of-life issues related to the aging cancer population. And Dr. Elting will end on a positive note, talking about supportive care throughout the process of caring for an aging population. I just wanted to acknowledge cancer registrars everywhere and epidemiologists who put together all of the information and the numbers and statistics that I presented to you today.